My name is Armin Scwarzbach. I'm a laboratory specialist for 30 years and I'm also a medical doctor. My laboratory is named Armin Labs. Armin Labs is highly specialized in tick-borne diseases, testings, and also advice when the results have finished. Tick-borne diseases are very common in the world. We know that ticks are full of pathogens of different bacteria, and my laboratory can test blood samples from infected patients for different bacteria. We name them Borrelia burgdorferi, it's the main bacteria in the ticks, and then we have also other so-called Coinfections. Coinfections are Bartonella, Ehrlichia, Anaplasma, Babesia, Rickettsia. And my laboratory is doing testings from blood samples from all patients all over the world. So we find out if there are immune answers against different bacteria or not in the blood of patients. The patients send their blood from all over the world because there are not so many laboratories specialized in diagnostic tests for tick-borne diseases like Borrelia burgdorferi, which is the reason for Lyme disease, and other co-infections. Co-infections are especially the four with the main bacteria in it, in the ticks. It's Bartonella, it can be also the Rickettsia, it can be Ehrlichia, Anaplasma, it can be also Babesia. And my laboratory is testing for all of these co-infections. There are some other laboratories in the world doing testings, but I'm doing nothing else, just testing for these infections.
Okay. And so do you get different strains of Borrelia around the world?
We have different strains against Borrelia burgdorferi. We know actually it's over 8 different strains which can make patients sick. The 3 very common strains in the world, in Europe especially, are Borrelia burgdorferi sensu-stricto and Borrelia burgdorferi garinii and Borrelia burgdorferi afzelii. In USA it's a little different. We have more Borrelia burgdorferi sensu-stricto, but all over the world we can find a lot of other different subspecies, we name that, and one of the most common subspecies is Borrelia burgdorferi garinii, which makes neurological problems and symptoms. We know that Borrelia burgdorferi is in up to 50% of infected ticks. So patients or people got bitten by the tick, and the tick, if the tick is full of this bacteria, then it can be transmitted into the body of people. And then the question is, how strong is your immune system? How strong is your natural immune defense against this, we name it pathogen Borrelia burgdorferi. And if your immune system is strong enough, you can defeat it on a natural way. If not, you can get symptoms. Symptoms for Lyme disease are at the beginning a bull's-eye rash. Bull's-eye rashes are also named erythema migrans. And, but it's not in all of the patients. We have just 50% of the patients, of the people who got infected, they really got this bull's-eye rash or erythema migrans. So 50% you cannot diagnose because they don't have this bull's-eye rash. And also 20% can get summer flu after tick bite. So it's very important to get to ask a patient, did you get some summer flu after tick bite? Because this is a sign for a current infection with Lyme disease. In this case, we name it stage 1 of the infection. If Borrelia is coming into your body by a tick bite, in a second step it can move around all over your body and can infect each organ system in your body. For example, it can inflame your brain, it can inflame your joints, your muscles, also it can inflame your kidney, your liver, your eyes. It can move everywhere in your body. And this means a local inflammation by a bacteria in your body which makes symptoms. The question is, which symptoms do you have after tick bite? A lot of patients I've seen, I think meanwhile several hundreds. Personally, I have seen in my office, and I found that a lot of patients, they developed chronic fatigue syndrome immediately. They got very tired after tick bite. They call it also burnout syndrome. They say, doctor, I have a burnout syndrome. Or the patients, they develop neck pain and headache, and especially where the tick bite was on the site, on this site where the tick bite was, the patients develop one of the first symptoms, neck pain, headache. And the next can be also migraine joint pain. It can be also another different symptom like arthritis. It can be a different symptom like neurological symptoms, sensitivity problems, burning hand, burning feet, loss of sensitivity, concentration problems, brain fog. So Borrelia can do every symptom in your body you can imagine. The diagnosis is named Lyme disease, which is caused by Borrelia burgdorferi from the tick bite. And how can you find out if you are really infected with it? That's a very difficult question, because you can diagnose by asking simple questions to patients. You can ask, did you have a tick bite patient? Can you remember that you have an exposure outside for tick bites? When did your symptoms start? Is there any correlation with stressing factors? Not 100%, but 90% of the diagnosis is done by clinical symptoms, by the questions. Chronic fatigue syndrome is a very common description of something. But the patients, they have more. Chronic fatigue syndrome is not the only symptom they show. They show also other symptoms like forgetfulness or memory fog, or brain fog, memory loss. They have also problems with burning feet. They have sensitivity problems. They can have joint problems, muscle problems. Chronic fatigue means that you're tired, but the tiredness is not the only point in these patients. The best way to get no tick bite means prevention, and preparation. The better you're prepared, if you have, for example, your clothes are very important, that there is no place where the tick bite can happen with you, for example. Also, if you walk in the middle of the trails, very important, not to lean on trees, not to walk outside the safe situation, not to sit in the grass. So the exposure is very important, and the consciousness. The tick bite doesn't happen immediately. You have also the chance after coming back from outside, from outdoor activities, to inspect yourself. You can inspect your hair, your ears, everywhere. You go under a shower, you look everywhere. You look at your back. Also for children, very important to look everywhere where a tick bite can be, because prevention means everything. The tick is not biting immediately. The tick needs time to bite. It's not done in 2 seconds. So you have time, no panicking. But prevention, prevention, prevention. The ticks are in the grass and they are not moving higher than little children are. They cannot climb on trees. They don't fall on you. So the prevention means that you really move around and that you inspect where is grass, where's a risk for a tick bite, where can you get bitten by a tick. That's your own prevention. And if you walk in the middle of the trails, there's normally no risk for you. But if you lean on a tree, that can mean you're collecting mushrooms. That can mean a risk for you. If you're playing golf, if you're doing soccer and you're playing in the grass, that means a risk for you. So also horse riders, the pets, you know where the pets are running around, you can see where the ticks are. If the pet is running around you and you find ticks on the pet, then it's for sure that this is a region with ticks. But don't panic about that, but be careful. The earlier you find out about an illness like Lyme disease, the better are the chances to get cured from it. The later you come, the more difficult it is, because if Borrelia is moving around your body, it's really difficult to defeat this illness and this bacteria. The probability to get an infection with Borrelia burgdorferi, it's not such a high risk, but the risk is there. And if you estimate 10 tick bites, for example, you get one-time transmission statistically of Borrelia burgdorferi, but that doesn't mean that you get sick by the infection. Nevertheless, we have numbers from USA, and in America we have around 400,000 new infections each year. And in USA, the CDC, they said some years ago, oh, we have just 30,000. That means we have more than 10-fold higher infected people in USA. What does that mean? If you look at 1 year and you do a look at in 10 years, you have 10-fold, 400,000, you have maybe 4 million infected patients. And that's a huge number. We have more and more problems with tick bites. Why? Because the outdoor behavior is different of the people. We are forced to go outside to do some sports activities because we are sitting the whole year in our offices. So we need more movements outside, but the risk is outside. And also very important, the climate is changing somehow. We have more and more ticks all over the world. The earth is heating up, so the ticks get active when it's 4 up to 5 centigrades. And also we have Lyme disease cases in Greenland or in Alaska or in northern Norway. So we have more and more ticks everywhere around the world. But also the testing is better now. We find more infected people by better testings, which didn't exist 20 years ago. We have better testings for it. We find more infected people and the consciousness is better now. The ticks are everywhere, but we know that not everywhere the tick are full of Borrelia burgdorferi, the pathogen. So we name it hotspots. It can be that in your garden all ticks are full of Borrelia burgdorferi, but in your neighbor's garden there's nothing. So by statistics in Germany, for example, 30% of the ticks are infected with Borrelia burgdorferi, but that doesn't mean that it's in your garden or it's in your forest. But it can be in your forest, and let me say 1 tick bite is enough to get sick. We have in USA the same situation. We have different tick species. We have up to 850 tick species in the world. So that means not every tick is infected with Borrelia, but they can be infected with Babesia or Rickettsia or some other pathogens. In America, they have the Lone Star ticks, for example, and the Lone Star ticks, they can be also, they live in the Sierra Nevada, in the deserts, where normally the ticks cannot survive, but they suck the blood from snakes, so they can survive everywhere, the ticks, where blood is, where a little moist is, so they can survive. And everywhere you can get a tick bite. Also in China, they live in the houses, the ticks, but they are different tick species. But the more and more we look what's inside the ticks, the more and more we find. A lot of patients with a joint or muscle pain, they have used LDN, low-dose naltrexone, successfully. I think the main indication is really the muscle and the joint problems in these patients. And what I've seen in many patients, that it's additionally a helpful option for therapies, and you have to use it in a long-term therapy. It's not to do it 2 or 3 weeks. So you have to use it in a low dose concentration. And then it helps a lot of patients additionally to other therapies. Main therapies are antibiotics and maybe other complementary therapies, but it's, let me say, a calm in the therapies of chronic Lyme disease. I'm a laboratory doctor and medical doctor, and I discuss a lot of cases with other colleagues, with other therapists about which therapy options do you have for your patients. And what I've heard the last 2-3 years, that more and more use LDN without knowing from each other that they're also using LDN. So LDN is an upcoming therapy option for patients with musculoskeletal symptoms. That means joint or arthritis or something, fibromyalgia or rheumatoid arthritis. So I see the main indication in this field, what I've heard from a lot of doctors. It's a good question if LDN can destroy Borrelia. I don't think so. Antibiotics can destroy it, we know that, but also antibiotics can fail. So I think it's additionally therapy to block the receptors, the opiate receptors, against the inflammation which is caused by Borrelia burgdorferi. So if you really can defeat Borrelia burgdorferi, you can destroy it by antibiotics, which is discussed in the world because we know we cannot destroy all patients with chronic Lyme disease by antibiotic therapy. That's not possible. So I think it's really a good, helpful tool, a good, helpful option for these patients to give it additionally to antibiotics, or if antibiotics fail, you can do your own trial maybe with LDN to improve the patient. The first step if a patient thinks he has Lyme disease or chronic Lyme disease with fibromyalgia or ME or chronic fatigue syndrome, the first way is to go to the general practitioner. And then the patient is telling the general practitioner, oh, I've heard that my symptoms can be caused by Lyme disease. Could it be possible that I have Lyme disease and not fibromyalgia? Or could it be that I have both? And then the doctor normally does an ELISA test for the antibodies for Borrelia. But we know that the ELISA is very insensitive, very often false negative results. The sensitivity, we name it, the false negatives are up to 70%. But the general practitioner, they don't know about that, the GPs. They don't know about that ELISA is not sufficient, not valid enough. So, but they believe in the ELISA. And what I can spread around the world, GPs don't believe the ELISA. Please do the Western blot. That's a good step because we can reach up to 60% sensitivity, but we fail also 40%. So what can we do? We can ask the patients very simple questions. Did you have a tick bite? Did you have a bullseye rash or some summer flu? But you know that this cannot exclude chronic Lyme disease. So what can we do again? I'm specialized in testings for the cellular immune level to find out if a patient reacts on the T cells, on the lymphocytes against Borrelia burgdorferi. And that was a breakthrough for me to find out that it has a higher sensitivity, it's less false negative than the ELISA. So if you would do it's named a LTT or ELISpot or some other of these techniques and it's positive, then it supports the clinical suspicion for chronic Lyme disease or an active Lyme infection. And then you can be treated for it. Actually, we don't have the best test in the world. Each test system complements the other. If you compare ELISA, you have around 30% sensitivity. If you're doing Western blots, you have around 60%. If you do the ELISpot, you have around 80%. If you do CD57 cells, you have around 70%. What is the message? The message is not everybody has an immune answer in his blood. So the diagnosis is a clinical diagnosis by the symptoms of the patients. We have now the problem that the symptoms overlap with fibromyalgia. So you can have lice and fleas, so you can have both. It's difficult to say, is it fibromyalgia or is it ME, is it chronic fatigue syndrome or is it chronic borreliosis, Lyme disease? What can it be for the patient? But the doctor has to do the anamnesis. Anamnesis is the key. Anamnesis means asking questions. Asking, do you have some changing migraine joint pain? Do you have some chronic fatigue? Do you have some sensitivity problems? Do you have some problems with your muscle weakness? Do you have concentration problems? Do you have chronic fatigue, ME symptoms? Always the same questions. And these questions, they mean 1 hour time for a patient. So this is the field of specialized therapists and specialized diagnosing doctors in front of the patients, and to think of all of the co-infections. You know, ticks are full of different bacteria. So we have to look more and more for multiple chronic infections in the patients. And it must not be Lyme disease. It can be also another infection. It can be a zinnia. It can be a virus. It can be an enterovirus infection. It can be a herpes infection. It can be Epstein-Barr virus, EBV infection. It can be CMV. It can be a lot of reasons behind. So that means differential diagnosis and this combination with the anamnesis, with a simple question with the patient, is the key to find out. And then if laboratory supports this by positive laboratory results, you say, yes, I find now the reason for it, and then you can treat. We have huge problems in finding out immune answers against Borrelia burgdorferi in the body. And for example, the British NHS system forces the patients and the doctors to do the ELISA for it. But we know the ELISA fails in 60–70%. So it's not like to diagnose an HIV infection. You cannot compare that. The problem is then how to diagnose. And if you just stay at the same test system with the ELISA, you will lose everything with a patient. You cannot diagnose a patient by this insensitive method. The ELISA is a worse method. So what to do? You can do the ELISpot, you can do the CD57 cells, and maybe you find more about this. But nevertheless, NHS is not doing that. We have the big problem in the world that everything is regulated by the CDC. CDC is in America the Center of Disease Control, and they are doing the guidelines, and within these guidelines they say doctors are just allowed to do the Borrelia ELISA and no other testings for Lyme disease. So they fail by these guidelines in USA, also a lot of patients. But the patients, they know more and more about that, and the patients, they want to do other testings. And then the doctors say, no, these testings are not in the guidelines, I don't do that with you. What happens? Patients are doing on a private baseline the testings, and that costs a lot of money for the patients because the systems are not accepting other testings for it because of the CDC guidelines. And CDCs all over the world, the guidelines are overtaken in other systems also by studies which are not evidence-based enough to do guidelines. Guidelines actually are just recommendations, and recommendations you don't have to follow up. Guidelines means you have to follow up, but these are no guidelines. They are sold as guidelines. And we think that's a big political discussion also behind that, how many people are really, or patients are really suffering now from Lyme disease. But we don't come forward by this way to say chronic Lyme doesn't exist. The point is that the CDC did the definition of post-treatment Lyme disease syndrome, and this is an unspecific diagnosis. Also, what's a post-Lyme disease syndrome? It's nothing. It's just a description of some symptoms. So this is no evidence-based medicine again. What we need a lot of science, we need a lot of maybe better testings. This is a postulation, it exists now for 10 or 20 years, but nothing happened. Lyme disease is a complexity of symptoms, but it happens after a tick bite. So that's for sure. And the doctors have to find out, was there some event in your life when you could have a tick bite? That could happen during childhood. Nothing happened afterwards. Then you got juvenile arthritis. Then it moved away. And then you got some immune suppression. And again, it comes back because Borrelia is really difficult bacteria. It can move everywhere. It can hide everywhere. It can do biofilms. It can do pleomorphic forms, cystic forms. It can go into cells. We have a lot of models about that. We know that. And this is a big problem, that the evade mechanisms, that Borrelia can evade the immune system. And it sleeps in your body like a lot of other bacteria can do that. And then if you get immune suppressed, then you get symptomatic. And then you get your joint pain, your muscle pain, and nobody is thinking about a tick bite. It's a very simple question. The doctors have to ask patient, did you have a tick bite before your symptoms started? In the actual situation, we know that it's a tick-borne illness. So the tick transmits the Borrelia burgdorferi bacteria into your body. The sexual transmission is not proven yet by evidence-based study. There are some hypotheses about that. Also, if you can transmit by saliva, if it's similar maybe to the syphilis bacteria, but still it's not proven. So long it's not proven, it's a hypothesis, and I don't think we should get hysteric about that, so long it's not proven. Maybe it can be, but I don't know actually. The tick is a dirty needle. It's not just transmitting Borrelia burgdorferi. It transmits a lot of bacteria, a lot of viruses, maybe, we don't know actually. We find more and more of these, we name it pathogens, bacteria plus viruses in the ticks. So what do they do in the ticks? We find Chlamydia pneumonia in the ticks. They found Coxsackie virus. They found enterovirus in the ticks. What do they do in the ticks? Could it be transmitted to humans? So we need a lot of studies about that to find out what is the risk by a tick bite, what is the risk by a mosquito bite, what is the risk by a horsefly bite. Can they be also transmit something? We don't know actually 100%. So long we don't know, there is a hypothesis about that, but we know that ticks are everywhere around the world. We have different Borrelia subspecies. A newer one is Borrelia miyamotoi. They found some months ago. It's not a new subspecies, but it came up that more and more of the ticks are full of Borrelia miyamotoi and that it can be transmitted. It makes some feverish reactions, also some joint problems. So we don't know all the pathogens. It's a dirty needle, but we don't know what's in the dirty needle. And no patient I've seen has just Lyme disease. All patients have multiple infections with different bacteria and viruses. And some patients have also yeast, mold. It depends. Each patient is different from the other. But chronic Lyme as a single condition, as a single illness, doesn't exist. Every patient has one of the co-infections or of the other opportunistic infections. Opportunistic means when your immune system got weakened by an inflammation, by Borrelia burgdorferi, something is happening in your body. And I think really that we have multiple chronic infections in a lot of patients with chronic fatigue, with ME, with Parkinson, with Alzheimer's, with dementia, with autism. So we have a lot of patients who suffer from different bacteria in the same body. And the important thing would be how important could play now LDN a role in this complexity of multiple infections. We are actually very concentrated on Lyme disease, but this is not the truth. We are looking more and more for viral infections, viruses in the body. We find a lot of virus infections in the patients with chronic Lyme disease, or patients don't suffer from chronic Lyme disease, but they suffer from chronic virus infections. We have to be careful to say everything is Lyme disease. But LDN can mean really a very, very interesting option in therapies for all of these conditions. We need studies about that, and I think that LDN is on a very good way to that. I think it's...
Is it bad marketing?
Yeah. I think it's a hype about Lyme disease, actually, what happened by internet and so by information. Yeah. And what I think the truth is in the middle. It's misdiagnosed in a lot of patients, but it's also overdiagnosed. We have to be very careful to put everything into the name Lyme disease. It's very easy to say, now I have Lyme disease, doctor, but maybe you have a completely different infection. Why? If you have a virus infection, you cannot use antibiotics in this. And the symptoms, for example, of an Epstein-Barr EBV infection are nearly the same you have in Lyme disease infection. So we cannot tell you what's now the problem in the patient. Be very careful to put everything into Lyme disease. That's a very important message for me. The eye catcher actually is the name Lyme disease. It means provocation. But we know that by testings, would say 50 up to 80% of the patients just show positive signs in laboratory testings for Lyme disease. Also by my tests, which are a little more sensitive than the ELISA tests. But we also know that the tests cannot prove Lyme disease. But what we have seen, patients getting diagnosed clinically with Lyme disease, they don't suffer from Lyme disease. They suffer from other infections, maybe from Bartonella infection or Babesia, or let it name a Candida infection. So we have to be very careful to put everything into one pocket to say everybody has now Lyme disease. And the multiple situation is a problem. Maybe a patient has an environmental problem with mercury or with lead, with the teeth, or a genetic problem. Or some patients coming, they have cancer. They don't have Lyme disease, but they have also muscle and joint pain, hormonal problems. So we need the differential diagnosis. We need good doctors caring for that in interdisciplinary teams. Not everything is Lyme disease. The big problem at universities actually is that chronic Lyme doesn't exist. It's not accepted. It's now named post-treatment Lyme disease syndrome, so you don't have to care for students to learn about that. And that's completely the wrong way. You bring students, which are really our future in medicine, you bring them away from chronic Lyme, you bring them to a syndrome. What does a syndrome mean? Some description of something. That's no diagnosis. So what we have to do, we have to take patients serious if they are sitting in front of us, and we have to ask them very easy questions, but also complicated questions, and doctors have to know more than the patients. But there's no teaching book, there's no university teaching about chronic Lyme disease, because chronic Lyme disease doesn't exist in the opinion of the majority of the doctors and universities. They don't accept chronic Lyme disease. So long it's not accepted, it's not for the students. They cannot learn about that. We cannot read about that. You have to do self-study, and this is a horrible situation. Some patients know more than doctors, and that cannot be. The problem, we have a system failure. The universities are just looking for the recent infection. That means bullseye rashes or acute neurological problems like Bell's palsy, or patients who are really sick. The chronically sick patients, they go to the GPs, to internal medicine, and then they have to decide. But they don't do the guidelines. The guidelines are done by universities. So we need guidelines from GPs about that. GPs who are caring for chronic Lyme patients, who take the symptoms serious and not sending patients away to psychiatric hospitals. This is what happened by these guidelines from universities. But the guidelines and all the test systems, ELISA, they were just developed for university purpose, not for chronic conditions. Chronic Lyme is completely different. Immune system is different. IgG is different. IgM is different. So we need science also in the chronic world. In the chronic world means GP world, but the GPs are not doing the studies. The studies are done by university professors, but they cannot do the studies because chronic Lyme doesn't exist at universities. Lyme disease is a completely underestimated illness in a chronic condition. We need consciousness about that. We need education, we need information, and we need prevention. And it's a big problem with an endemic situation. I would not say it's epidemic, but if you summarize all the endemic hotspots in the world, then you can get the impression that it's somehow epidemic like influenza can get. So Lyme disease is really a threat for the future.